Versa Creative is an award-winning marketing and advertising agency dedicated to empowering brands with result-driven strategies. The Versa Creative podcast is our place to have a discussion on the marketing industry, marketing trends, and most importantly, provide insights to our listeners from our experts. On today's episode of the podcast, I have the pleasure of speaking with our PPC manager, Herbert Murcia. How are you doing today, Herbert?
Doing great. Thanks for having me on.
So for today's episode, Herbert, I wanted to bring you in to talk about PPC, but more specifically talk about PPC in the healthcare industry. So for our listeners, Herbert, could you describe PPC to its most basic definition so that our listeners can understand, those who maybe aren't familiar with PPC?
Sure. PPC advertising is essentially a form of advertising in which you pay for a click. Now that can encompass a whole variety of different types of advertising. It can encompass search, it can encompass shopping, video, display, discovery, all sorts of different types of advertising. Just depends on really what kind of audience you have and how you want to reach them.
Yeah, so I think the most common type of PPC ad that people are familiar with are definitely search ads, right, which are the very first thing you see at the top of your search results page. And it usually you usually see the little ad symbol right there. Correct. And that's how you know it's a PPC ad. But what other types of PPC are there?
There's many types. There's display ads. There's YouTube ads, which people are probably much more familiar with. There's Google Shopping ads as well. There's discovery ads. There's really a wide variety of different ads, and it just all depends on what someone ultimately wants to accomplish.
It's funny that you bring up YouTube ads because you might see search ads and YouTube ads and think that they're completely separate, but they're both types of PPC. So yeah, as we kind of covered just now, PPC is pretty diverse and there are many options as well as different goals that advertisers can set with PPC. So let's dive into the healthcare realm. So with PPC, there are many different goals that advertisers can set. PPC can be used for brand awareness, to get patients in through the door, book appointments online. There are many options with PPC, but because of that, it can get kind of overwhelming. From your perspective, Herbert, is PPC accessible to the average person, or should they come to an expert like you?
It's accessible to the average person. However, there is a benefit to hiring a professional in that you save yourself a lot of time, money, and effort.
Yeah, I think like you said, PPC, especially if you want to run a successful campaign, it's pretty involved. It's what you do every day professionally. So there is a whole career around it, especially if you want to get success. Like you said, I think it's really important when you're running PPC ads to keep in mind your goals and also your budget, because you want to see that return on your investment.
Yes, it's definitely accessible to the average person. Google does provide a ton of free resources out there in which people can learn how to, do PPC on their own. However, there is a major benefit to hiring an industry expert in the sense that you save a lot of time, money, and effort. For us, this is our everyday. We're in the accounts. We're able to, do keyword research, look at ad copy, A/B test, all sorts of different things. And in the long run, it could prove very beneficial for a given business.
Funny enough, one resource where people can learn about advertising through PPC is online. Like you said, there's websites, blogs. You could check out the Versa Creative blog for a recent article about PPC, specifically for dentists, as well as other articles about PPC. But yeah, there's definitely online resources, but there is a benefit to working with professionals. So another common question that we hear when it comes to PPC is PPC expensive?
Yes, it can be very expensive. You can pay sometimes upwards of $30, $40, sometimes $100 plus per click, which makes it all the more important to know what you're doing because you don't want to waste any money, or at least, minimize the risk of doing that.
So in healthcare, Herbert, are there any restrictions that advertisers should be aware of, since this is sometimes involving patient information and things like that might be protected by federal law?
Definitely. There's one major form of advertising that we utilize for other businesses that we can't do for healthcare clients, which is remarketing, which is the process of retargeting people that have visited your website and may have been interested in your given services, but didn't, call or complete a form at that given time. That's something that Google as well as other search engines are very restrictive about, and that they don't want to risk having someone see an ad that might be based on a health condition that they have or something like that. They don't want to mess with anything as far as HIPAA related, So that's definitely something that we always keep in mind. And
I know one thing that we always do with our PPC clients, or really any website that we do, is you have to make sure that your privacy policy is available. Again, that's a big just thing that you should see across the web for your own sake, but just for the sake of your personal information, you want to make sure that websites aren't abusing your private information. Right. And especially when it comes to healthcare, privacy matters.
Definitely.
So obviously, keeping in mind patient information and privacy is important when running PPC ads. Do you have any other tips for our listeners about running a PPC campaign?
For sure. Look through all of your possible ad extensions that you can use. Take advantage of site links. Take advantage of call outs, structure snippets, just because those provide much more visibility and help you take up more ad real estate whenever your ad does appear. And that can be very beneficial as far as driving better click-through rates, better conversion rates, and just overall just general better performance for your efforts.
Yeah, like you said, ad extensions are something that's kind of useful in this realm. We know as an SEO person, obviously I want to be on that first page, but with PPC, you can be at the very top and take up more of that important real estate on the search results page. That kind of matters, and it's one way that you can help your PPC campaigns.
Definitely. I would also add too that you can add in negative keywords, which going to a prior point about how you can easily waste a lot of money. One way to mitigate that is to do a lot of keyword research and go through all your search terms, see what people are searching for, because for all you know, you might end up running into scenarios where someone's searching for a very specific term that may not be related to what your services are. So you can add that as a negative keyword, and then in the process, save yourself a lot of money.
Yeah, one of the most involved parts of a PPC campaign is definitely analyzing your active campaigns. Through the Google Ads platform, you can see where your ads are showing up and what searches people are seeing your ad for. It's through that you can identify those negative keywords so that you don't show up for those searches that are irrelevant to your campaign or your services. Any other tips?
Yeah, I would say do a lot of A/B testing, just because that's something that you'll find over time that is very beneficial. You might try out, say, a different headline or a different call to action, and you'll see that maybe something such as simple as call now versus call today has a very big impact on your conversion rate. And as you go on through it, you can implement more of those results within your ad copy and just constantly continue to improve.
As a healthcare provider, I think it's also important to keep in mind who your audience is and who your patients are. So if you're a really localized provider, you might want to make sure that you're only targeting certain areas, certain zip codes, which are all possible through the ads platform, correct?
Yes, you could target down to the zip code level. You could target radiuses as well. Counties as well. This is pretty broad as far as how you can go about targeting geographical areas. However, there is, with health in particular, the risk that if you try to get very specific, Google can potentially put you in a situation where your ads are limited because of health and personalized advertising. We've seen that happen a lot with accounts, and we deal with it every day.
So one thing that advertisers have to keep in mind when running PPC campaigns is Google has to approve everything. Are there any things that Google wouldn't approve for PPC campaigns in healthcare?
Definitely one thing to keep in mind is any type of display or discovery, any sort of advertising like that, you can run into issues where Google will disapprove images, copy, and then you have to go through the process where you go ahead and adjust the ads and then possibly even remove certain elements to make sure that they're approved and that they're eligible to run. Also remarketing, where you can't retarget people that have been on your website, and Google's very, very protective about any restrictions.
So in PPC, there's a lot of like terms that get passed around and terms that like we hear from clients. Could you address any of these terms that might be misunderstood or often used in the wrong way by clients or those who maybe aren't as familiar with PPC?
Of course, one big one is geofencing. That's one we've heard from a lot of clients over the past several years, where it sounds like something amazing. You target a 1 mile radius around a given building and office, something like that, and then you just show ads as much as possible to people within, say, a month or however long time frame. It sounds great in theory, but in practice it's not always the best approach, just because you're pretty much counting on someone in that very same area searching for something that they may not even be searching for at that given time. They might be searching for it somewhere else. Or if you're trying to do display advertising and just hitting people as many times as you can with your ads, you can also cause ad fatigue, where they just get tired of seeing your ad constantly. It can work, just that it may not always be suitable depending on your industry.
Yeah, I think going back to something we kind of brought up earlier, A/B testing is really important for any type of campaign. You want to make sure that the ads you're running are producing the results you want. So because of that, you might start out with like 3 different approaches, but over time you find that your geofenced 1 mile radius isn't producing as many results as like maybe a slightly broader campaign that's targeting the surrounding zip code or something like that, just a larger area. A/B testing is really important for any type of campaign. Are there any other words or things that people might misunderstand about PPC?
Sure. There's one other one that really springs to mind, which is impression share. It's something that over time, more and more businesses have become aware of, which is, a good thing. They don't know exactly what it means. And pretty much what it means is just, it's the percentage of the time in which your ad is eligible to show on a given search result. So if you have a impression share of 80%, that means that your ad is eligible to show 80% of the time. 20% it's not. So it's always something good for us to look at as far as what are things that we can do to go about improving it, because the higher it is, the more likely that someone will see your ad, and the more likely that they'll move forward and decide to call, buy something, whatever your given desired action is.
Thank you, Herbert. So moving past those terms that people misunderstand, is advertising in healthcare competitive or difficult?
It's both. It's very competitive depending on the area in which you're targeting. If you're in a very rural area where maybe there's 1 or 2 or however many competitors, then yeah, you may not have to pay a ton. But if you're in a very densely populated area, such as say downtown Houston, then yeah, it can get very expensive, because you have a lot of hospitals, a lot of clinics that are all vying to be in the same positioning as you, that were even higher. So that's what really can drive up the price a lot for a given click, and can end up making the process much more expensive, and as a result, make it much more difficult, because you have to be even more on top of everything as far as A/B testing, and you may not even be able to do that much A/B testing because a lot of your budget will go away very quickly. So it's just very difficult in general to do.
So Herbert, can advertisers run PPC campaigns in various languages to target different audiences?
Of course, we run campaigns in other languages for a lot of clients, particularly in Spanish, which is something that can be very beneficial depending on the given business, and if the right things are in place. Like if you have a website or a landing page in Spanish, then that's awesome. We could potentially drive traffic to it, and it can also end up being cheaper actually, because there's not that much competition for other languages. English is obviously the dominant language in the US, but Spanish is definitely one to consider. One other thing to keep in mind too is the different the kind of audience that you're pursuing and how they speak other languages. Like for example, from my end, I'm of Mexican descent, so my form of Spanish is going to be different than someone in South America. And if your audience is in South America and they see ads that are written in Spanish that's more specific to Mexico, then you may not reach them as effectively as you want because it's not going to be using words that relate to them.
So outside of Spanish and English, I'm sure you can use other languages, right, Herbert, just depending on the audience and what benefits the company.
Of course, you can target any other language such as Portuguese, Chinese, like any one that might be relevant to your particular audience.
So while we're talking about audiences, when you're setting up your campaigns, what kind of targeting can you do?
You can do all sorts. You can do in-market audience targeting. You can do live events, like if you want to target someone that just recently got married or recently purchased a home, you can do that. If you want to target somebody by their hobbies, like if they're avid travelers, you can do that as well. Or if you're just like have a very specific audience that maybe Google doesn't always like have already right there ready for you to select, you can utilize something called custom audiences, which allows you to target people based off of like certain words, maybe certain phrases that they used like in the past when they were searching, or other things that would describe them that you may not already be able to see within the Google Ads platform. And there's others as well, such as demographic targeting, which I think we might have touched upon a little bit, such as by gender, by age. There's really a wide variety of targeting options, and it just all depends on what your target audience is and the best way to try to reach them.
Yeah, I think going back to like A/B testing, making sure that you're targeting the right audience can actually help you benefit and improve your campaign. So if you notice that your campaign isn't improving or isn't performing how you want it to, you can actually look at who is converting and hone in on that audience, right?
Right. You can set, Google has a really cool option, and I've seen this in other advertising platforms as well. You might see some things such as where you have audiences such as people that own a home, and then people that are renting homes. And say you might have a product that's for, home care, like things like cleaning products. And you might assume, well, it's really more geared towards people that own a home, when in reality, people might actually, people that renting apartments or homes are more likely to end up buying it. It's just things that maybe you might not otherwise have previously figured out, and you just see as you start getting data. And that makes it great, on our end, because we can actually like make bit adjustments and then improve the campaigns even further based off data that we wouldn't have seen otherwise ourselves.
Thank you, Herbert. So one last thing, do you have any closing thoughts for our listeners about PPC in healthcare?
Yeah, I know we touched upon a lot of things over the course of this podcast, a lot of awesome, helpful information as far as the different ways in which you can utilize PPC advertising to help your business. I would just say, that it can be great. Just depends on really what your audience is and how you want to best approach them and how that relates with your overall marketing goals. Do you want brand awareness? Do you want leads? Do you just want more foot traffic? It could be a wide variety of things. Every business is different, and that's totally understandable. So, just something that could be very helpful.
Thank you for listening to today's podcast on PPC in the healthcare industry. As always, if you have any questions for me, any of our experts, you can reach us via email at info@versacreative.com. Thank you for listening.